Hello, I'm Jacqueline Jackson, chiropodist at the Leamington and Tilbury Family Health Teams. In this video, I will discuss a common foot problem called plantar fasciitis. Plantar fasciitis is a common overuse injury. It is characterized by acute heel pain first thing in the morning or after rest. The plantar fascia is a thick, non-elastic band of fibrous tissue that runs from all 5 metatarsal heads and attaches onto the calcaneus, which is the heel bone. Its primary function is to maintain the medial longitudinal arch of the foot. The problem begins when there is stress applied to the plantar fascia and the plantar fascia pulls away from its weakest insertion, causing micro tears. This can occur at the heel, or it can occur at the midsole or towards the toes. The micro tears cause inflammation and pain. Since it is difficult to rest the foot, the situation is aggravated with every step taken. The problem progresses rapidly, and treatment must start as soon as possible. As the fascia is pulled away from the bone, the body reacts by filling in the space with new bone, commonly called a heel spur. The heel spur is a secondary X-ray finding and is not the problem, but is a result of the problem. Some predisposing factors for plantar fasciitis are flat, pronated feet, or high arch, rigid feet, inappropriate footwear, increasing age, and overuse. So, how do we prevent and treat plantar fasciitis? Number 1, rest. Rest is the first and most important part of treatment. Your feet carry your body weight with every step the injury gets aggravated. Weight-bearing activities should temporarily be put on hold. Long walks or runs should be replaced with things like swimming or cycling. Number 2, shoes. Shoes are an important element to the recovery of foot injuries. Supportive athletic shoes, preferably walking shoes, with extra heel cushioning, rigid heel counters, and lace-up mechanisms provide the support and balance necessary to assist on healing injured feet. Orthotics. Orthotics are custom orthopedic devices prescribed by your chiropodist. The orthotics serve to realign your foot and prevent any abnormal compensations due to biomechanical abnormalities. These abnormalities, if left untreated, cause flat feet or fallen arches to pull the plantar fascia. Should symptoms persist, conjunctive therapy can be introduced. Things like plantar fascia night splints. These splints are designed to keep the plantar fascia in an elongated position overnight, therefore reducing the initial stretch that occurs when you take your first step in the morning. Laser therapy or ultrasound. Both of these options are good treatments. Photochemical responses or sound waves in the tissue help control pain and accelerate healing. Manual foot therapy. Manual foot therapy is a treatment which involves the realignment of the bony structure of the foot, thereby improving lymphatic drainage and blood flow. Cold and hot therapy. Inflammation is reduced by placing the inflamed heel in hot water or on a heating pad for 2 to 5 minutes, then in cold water or an ice pack for 2 to 5 minutes. This alternating should continue for a total of 10 times per session and done several times throughout the day. Cortisone. A cortisone injection may become necessary if the other therapies do not solve the problem. It is a local injection and it is very safe in this area. Some other short-term relief for plantar fasciitis include heel pads. Heel pads are made of felt or sponge and can help absorb the shock as the heel lands and ease the pressure on the plantar fascia. These heel pads are either pre-cut or have softer material centrally to deflect pressure away from the painful area. Heel pads and heel cups are available at most drugstores. Taping. Taping your foot to maintain the arch will take some tension off the plantar fascia. This will provide short-term relief in acute cases. Taping can be done by your chiropodist, or sometimes you can access taping videos on YouTube. Medication. Your chiropodist or doctor may prescribe anti-inflammatory medication. Anti-inflammatories can play an important role in reducing inflammation in your feet. However, this is not a long-term solution. Anti-inflammatories can come in the form of oral anti-inflammatories or topical anti-inflammatories that can be rubbed on the foot. Exercises. These exercises are designed to strengthen the small muscles of the foot to help support the damaged area. If they are performed regularly, they will help prevent re-injury. First, the tennis ball roll. Using a tennis ball, roll your foot back and forth over your arch and heel area for 2 minutes. You can also use a cold can of pop for this. Towel curls. Place a towel on the floor and then curl the towel towards you using only the toes of your injured foot. Resistance can be increased with weight on the end of the towel. Repeat this 20 times. Shin curls. Run your foot slowly up and down the shin of your other leg as you try to grab the shin with your toes. Repeat this 30 times. A similar exercise can be done curling your toes around a tin can. Toe grabs. Standing with your feet together, rotate your knees outward while attempting to grab the floor with your toes using the muscles of your foot. Hold this for 10 seconds, then relax. Repeat this 20 times. This takes some tension off the plantar fascia and can provide short-term relief in acute cases. This concludes my video on plantar fasciitis. If you are experiencing unresolved foot pain, please contact your chiropodist or your doctor. Thanks for watching.